Good morning. I'm Dr. Ross Morgan. I'm the Center Director for Plumas Rural Health Center. We're here outside of one of our three clinics where we are dedicated to continuing to provide you with excellent health care safely during the COVID pandemic. Currently, as you know, we're in the highest tier of restrictions and precautions, which means we are doing things a little differently. But today I'm going to talk about how it is that you can get your healthcare needs met safely. When you call Plumas District Hospital to schedule an appointment, you will be first and foremost offered a virtual visit or video visit, which you can do from the safety of your own home using your own computer and webcam, laptop with camera, or iPhone with camera. This is done with our patient portal, which has been excellent, and we can assist you with getting that set up for the first time. Also, we can use applications such as Zoom on any of those devices. And lastly, you can come down and just park in one of our parking spots, and we will loan you one of our devices and get you set up for a virtual visit or video visit while you're here staying in your car for the entire time. All of our providers are going to be offering these types of virtual visits. If it's determined that you need something else, there are two different locations where we can see you in person. The schedulers will ask you questions about symptoms that might indicate that you have something contagious. In that case, we'll see you in our dedicated hall here, Lawrence Hall, in the Quincy Family Building. When you come for an appointment because of a possible illness, or if you just have symptoms that might indicate contagion, or if you've had exposure to COVID, or possible exposure to COVID, you'll be scheduled here in Lawrence Hall, and you'll wait outside in a parking spot and do your registration over the phone. Once that's done, you'll be brought in through the special private back door and straight into a room without having to wait in the waiting room. There you'll see your provider, and you can exit through the same door and leave the facility without ever going into the waiting room. Lastly, if you don't have any of those symptoms or suspected COVID exposure, we'll see you much the same as we have, with some important changes. Number one, everybody is going to be wearing a mask. Right now, I'm going to make sure this is fitting me properly so you can see what it's supposed to look like. We'll ask you to put a mask on when you leave your car, and we'll provide you with a medical grade mask when you enter. We also have a no visitor policy with some important exceptions. Children, of course, will have an adult parent or guardian with them, and adults who require assistance to get in and out of their appointment or require somebody to be with them to effectively communicate with their provider will be able to have one visitor with them. Otherwise, everybody else that comes will be asked to wait in the car. So please plan ahead for that. When you do come in, if you've been screened also and you don't have any symptoms suspicious for infection and you don't have a temperature, which will be checked, you'll go ahead and see your doctor as you have always done in the past. And hopefully when you leave, you'll schedule your follow-up appointment as a virtual visit. That is our goal. I want to thank you for listening, and be aware we're going to be doing future posts on different topics, including the COVID vaccine, which I certainly hope most of you will receive soon, as well as what you should do if you actually have COVID. Thank you very much, and Merry Christmas, Happy Holidays from all of the Plumas District Hospital staff.